Then we will jump right in. So welcome everybody to the webinar about health insurance options for 2017. As Andrea had said, we will be recording this, so if there's any questions that you have afterward, you can reference back, or you'll definitely have my contact information so that I'm happy to get in touch with you after the fact, or as she also said, you may use the questions box throughout the next hour, hour and a half. So jumping in, see here. All right. So what are we going to cover tonight? We are going to look at, first bullet point, health insurance is complicated. It is hard to know how to get the most bang for your buck. The second one, why have health insurance? Also, what are your options? The big one right in the middle here, how does the election affect options for 2017? I'm sure a lot of you, I think we had 47% said you have health insurance marketplace coverage. You might be wondering, how does the election affect your options? Also, we'll cover getting help to pay for health insurance, understanding health insurance words. So this is really looking at once you're signed up and you're seeing all these words like deductible, copay, coinsurance, what does that mean? How do you use your care and know what costs to expect? And then questions that you could consider when choosing a plan. So really the goal is that we're hoping that whatever brought you to this webinar tonight, that we want to get those questions answered. We'll work to address any health insurance questions you may have, and hopefully whether it's a question you have for yourself, for a family you work with, for your neighbor, whoever it may be, hopefully we'll give you some pieces of information that you feel a little more informed after tonight. So my name is Jenny Appleby, and I work for an organization called Covering Wisconsin. I am a health insurance literacy specialist. My background is actually in human development and family studies, so that was my degree with a focus on child development. So prior to working for Covering Wisconsin, I have worked in a variety of child care settings and also just some different youth serving organizations as well. And there you will find my email address and my phone number, so feel free to call or email at any time. So a little bit about Covering Wisconsin. So our name is Covering Wisconsin. You might see it listed as CWI. We used to be called Covering Kids and Families. We're the same organization. We just changed our name because we serve more than just kids and families, so we didn't want it to sound too exclusive just for the younger kids and their parents. We have been around for about 13 plus years. We provide education similar to this venue tonight where we're talking about health insurance, sharing information, and also we do actually do some assistance with signing people up with programs that support health. So it's not only health insurance, we do some work with the school free and reduced price lunch program as well. We are a navigator entity, and what that means is that we are providing free in-person health insurance application assistance. So some of our staff actually does sit down and do health insurance applications with people, getting them signed up for insurance. We also develop health insurance materials. So we are going to be sharing some of those materials tonight. You're going to see some of those. There is also one of those handouts that is available in your dashboard there. You'll see not only the slides for this presentation, but you'll see one of those health insurance options handouts there. We do train people on health insurance topics in Wisconsin and nationally. And the last bullet point there is just some of our funders that are specifically supporting this webinar and our work, which supports health insurance literacy, and that's the Wisconsin Department of Health Services, the Wisconsin Health Information Organization, and the Baldwin Idea Endowment. I should mention that Covering Wisconsin is grant funded, and so all of our funding comes from a variety of grants. You could consider us nonprofit. We're actually based out of the UW-Madison School of Human Ecology, so we do have that academic university-based component too. We have two offices, so our main one is out of UW-Madison, and then we also have a second office in the Milwaukee area. That's the one I work out of. And another thing I'll note is that my colleague Stephanie Sievers, who I work very closely with on all these projects, she will be doing the presentation tomorrow night in Spanish. So both Stephanie and I have been working very closely with this kind of education and outreach. So going into the next slide, slide number 5, we are hoping that after this presentation, we can provide you with some answers to the questions that you might have. So I'm going to read these questions aloud, and what I'd like you just to think about is what's most relevant to you. Are you kind of listening in tonight because you fall under number 1, which is you're kind of wondering what is the best health insurance option for you and your family? So some of you tonight may be coming because you want to know these kinds of questions and answers for your own self, and that's great. Some of you might be falling under category number 2. Maybe you have a position that is through a larger group center. You're a teacher at a group center, and you want to know more what options are available for the families you work with, because sometimes you get those questions. Maybe you work on health programming within your center or something of that nature. So it might be that you have number 1 questions for you. It might be that you more want information so that you can give to other people. Maybe it's number 3. Maybe you're a little confused about your insurance. You're wondering what some of these terms might mean. Maybe it's number 4. You want to know how to get the most bang for your buck. Or number 5, what is the best plan for your budget and your health needs? Costs are something that come up all the time when we talk about health insurance. People might have health insurance, but they feel like what they have, they're spending so much money and they don't have good coverage. And so that's one of the things that it's not only about having insurance, it's about having insurance that you and your family can afford. So jumping in to slide number 6, what does it mean to have health insurance? This is something that is a conversation a lot of times professionals in their role end up having with families who say that they're uninsured, or maybe you have a kid or a child within your center, and when you do those intake forms, you notice that they checked the box for not having insurance, or there's no doctor listed, and they tell you, no, we don't have insurance and we can't afford it. Obviously, that's a personal choice. Everybody can make their own choice whether or not they're going to be insured. Some of the things that we talk about when a family does say they're uninsured is we just kind of explain that, you know, having health insurance is going to pay for some or all of those costs associated with medical care. A lot of people, the idea of them needing to use health care can resonate with them. Almost everybody we talk to at some point in their life, they've been to a doctor, they've seen a doctor. Whether it was paid for by health insurance or not is another question. But people can kind of understand that of, you know, what if I got in an accident tomorrow? Would I be able to pay for that? So we kind of talk about that. It can also give you discounts for your care. So, you know, people say, well, I'd rather just pay when I use it and pay out of pocket. Well, maybe health insurance could help cover some of those costs. The little gavel that you see there is that currently under the Affordable Care Act by law, you must have health insurance or you will likely pay a fee. It says likely because there are some exceptions, and we'll get into those a little bit later. But some people get insurance to have it as a safety net, and then you will definitely have others, and maybe this is, you know, your situation as well, where you think, why do I need it? Maybe you're young. They always talk about the young invincibles. You're young, you're healthy, you've never really needed it, you didn't go at all last year, why would I need it now? And then a huge question that is usually at the forefront of people's minds is, can I really afford it? Okay, so what you'll kind of see is on the side when we have the index here, we're going to kind of go through these different topics. And right now it's just the importance of health insurance. So here's this little meme that we put together to kind of mix it up a little bit. But yep, maybe you're going to take a tumble down the stairs and then you're going to wish you had that health insurance. Or, you know, something unexpected comes up. You get in an accident, you get pregnant. There's so many scenarios that can happen where all of a sudden you're going to be using medical care, and if you don't have it, you know, is it too late? Can you sign up? Is it open enrollment? All that kind of stuff. The first bullet point here is really talking about prevention, though. One of the things is that when you have health insurance, studies will show that generally when you have health insurance, you're more likely to go to the doctor. And so if you're going for that yearly checkup, they're going to identify issues, identify things early on that are generally cheaper to address than later down the line when something gets more severe. Having health insurance obviously keeps those costs down so that you're not paying out of pocket. You're not going to accumulate those medical bills for accidents or unexpected sickness, and for a lot of people it's just simply a peace of mind. I know for myself, I have young kids, and it's a peace of mind. I want to know that if they're sick, I don't have to worry about, are they going to be okay? I can take them to the doctor because I have that insurance. Moving on to slide number 8. People who are new to insurance, sometimes it gets a little complicated to understand the concept of it, that you are paying every month for it even if you don't use it. And so when somebody's new to insurance, what we try to do is we try to have the analogy of, okay, insurance is like having a monthly gym membership or having a cell phone plan or just car insurance in general. You're paying for it every month whether you use it or not. If I have my cell phone, even if I never make a call, I'm paying that monthly bill. But unfortunately, a little different than some of those other things like the cell phone plan or the gym membership is the difficulty of insurance. And it is complex. It's difficult to understand and it's difficult to use. So the consequence of all that is that we may not take advantage of the best options, and our choices may cost us more money. So obviously this little cartoon is a joke, but this is kind of when somebody doesn't understand it, doesn't understand costs. Your insurance only pays 80% of my fee, so I only took out 80% of your appendix. The point being is that when we don't understand our coverage, we might not take advantage of what we do have, and we might make choices, and we might go to a doctor that was out of our network and now we're getting a bill, or maybe something else was covered and we didn't know. So having it is one thing, understanding it is another. So looking at slide 10, the biggest complaint that we hear is that the words and the plan descriptions are too difficult for a lot of us to understand. So when you're picking that plan, and when we see that almost half of you on the call today have marketplace insurance, you were all faced with the decision of which of those plans you were going to pick. You got through the application and then bam, here's a bunch of plans, and you have to sift through them and try to figure them out. And you may not have chosen the one that was best for your needs or for your budget. Maybe you wanted to make sure you saw a certain doctor, or you only spent a certain amount a month. And that's the kind of thing that we'll address today in this webinar. So we're just going to take a quick pause moment. This would be a good time to enter questions if you have them, but I'm just going to kind of throw out a case example and something to think about. Maybe this question pertains to you, and maybe it pertains to a family that you work with. But as an example, Sarah and her family have Obamacare. That's what, they know that it's called Obamacare. And she's been hearing a lot about that in the news, and she's not sure if it's going away. She's confused, and she's not sure what to do. And I will say that if you turn on the nightly news, almost every night you're seeing, Obamacare is getting repealed, it's getting replaced, what's going to happen next? So kind of think about that scenario, think about if you're in this situation, think about if you have a family that you work with that's in this situation, and what questions they kind of have about that. So going into the next topic area of in the news, the future of the Affordable Care Act. So healthcare was a hot topic. It was in the debates, it was getting talked about a lot, and the presidential election does bring a lot of questions about the future of health insurance. I will say that as part of UW-Madison, as our employer at Covering Wisconsin, we do not take partisan positions on any health policies. So we stay pretty neutral. Our goal is really just to understand what's out there and to try to give the best information and try to make things understandable for other people. So that's one of the things, is that we're not for or against the Affordable Care Act. We're not for or against different changes that are coming down the pike. What we try to do is understand them and then explain them back to people in simpler terms. So we'll read the policy and then we'll try to make it understandable to you all. So the second bullet point here on slide number 12 is the Affordable Care Act. The Affordable Care Act is also known as the ACA, or the nickname, which some people like and some people hate, is Obamacare. All of that refers to the law, and then when you are following that and you're going to get coverage through the Affordable Care Act, you would sign up on healthcare.gov, or what's also known as the marketplace, or the health insurance marketplace. So to kind of wrap your head around that, they're basically all synonymous. You know, some are referring more to the law and some are more referring to the website, but that's all kind of the same thing, and that's really what's getting talked about a lot. So you might hear it being called any one of those terms. At this moment, that is still the law. Nothing in the Affordable Care Act at this point has changed. So looking at slide 13, the insurance options still remain available for the 2017 calendar year. So for those of you in the marketplace, you're still going to have that same insurance for 2017. If you are uninsured, you can still continue to enroll in insurance that's best for your family, including the coverage and the financial help that's available through the marketplace. So if you're uninsured, the marketplace has not gone away yet. You can still sign up at healthcare.gov for insurance for 2017. And also, by law, you still must have insurance or you will likely pay a fee when you file your taxes. So kind of be prepared for that. Is that, again, we'll cover those exceptions later, but if you are uninsured, you will likely pay a fee when you file your taxes. So I'm just going to pause and don't worry about the silence, but I just want to give people a chance to kind of type in any questions they might have into the chat box. So if you have any questions about changes or the Affordable Care Act or anything you've been hearing in the media lately, go ahead and type those now. Okay, I'll still keep an eye on it, but we'll move along to slide 14. So we're going to jump right into the health insurance options. And this is relevant to everybody because sometimes you're signed up for one and you don't realize that, oh, maybe there's actually something that I'm eligible for that might be better for me or my family out there. So the screenshot that you see now is of the attachment that was one of the handouts called the Health Insurance Options handout on the side panel box. So this sheet is also available on our website. So coveringwi.org, when you do the /learn, you're going to see this handout and you're going to see a variety of other handouts. So at any point, whether it's, you know, now when you're looking at the webinar or later, feel free to go to that website. All those documents that we've created are free for anybody to download, to use, to print at your leisure, to hand out to other people. If you're ever going to do them, to hand them out on a really large scale, so let's say that you do work in one of those group settings and you plan to give it to every family that you work with or something, we like to know about that. So just feel free to get in touch with me if you're going to do, you know, a mass distribution or something. But this handout in particular, and what we're going to go through in the next few slides, is really just those different options that are available to people. We talk about this most frequently when somebody would come and say, you know what, I have insurance, but I'm paying too much, or I'm uninsured, what could I sign up for? This is a great sheet because it's a great starting point, and generally through our conversations, we can figure out what might be the best choices for somebody. So looking at slide 15, I'm just going to ask you to kind of think about your own personal situation and other situations that you might be having conversations about. You know, maybe it's the family that you work with or your brother or somebody, but this is an example of thinking about an in-home child care provider who's just starting out. So let's say she recently left a full-time day job, which offered health insurance, to branch out and have her own family child care setting. Her spouse is not offered insurance through his job, and she looked up an insurance company online and got a quote for $560 a month. Her family cannot afford that premium, but they need to figure out how to make sure they're covered. So this might happen, you know, for those of you that are family child care providers, when you become self-employed, you don't have that larger employer to now rely on to provide your coverage. So let's try to figure out what options might be available. So looking at slide 16, the main things that come into play as to what you're going to be eligible for are, number one, your income and your household size. When you think about your income, you need to think about everybody in the household and how much income is being made. So it's not just the income that you're bringing in, it's your spouse as well. And the same thing for your household size. So when you think about that, all these things that you're signing up for, it's going to ask about your household, and when you think about your household, that's who you file taxes with. So if you are the parent and you have dependents, if you're claiming those dependents, then they're part of your family unit. So that's kind of how you have to think about it, is who are you filing taxes with? That's what's, when we're talking about health insurance, that's how we're looking at your household. What gets a little complicated, is that each person in your family might end up qualifying for a different health insurance option. And that's just because all these programs have different eligibility based on whether you're a kid or an adult, whether you're pregnant or not. Are you a senior? Are you over 65? You know, sometimes people's spouses can get insurance, but only for one person, a single plan, not for their whole family. So it gets confusing because not everybody in your family might have the same insurance, but that's something we can help you work through. So on that health insurance options sheet, you're going to see that we kind of start from number one and go down the list. And so the first thing that we need to look at is, can you get health insurance from your job? So oftentimes people say, yeah, I can, but it's really expensive. Well, there's actually a formula, there's math that goes behind it as to whether something is considered affordable or not. So this affordability worksheet, I'm kind of jumping to bullet point number bullet point number 3, is this affordability worksheet. You'll see it on our website as well at coveringwi.org/learn. And this worksheet, we tried to make it as simple as possible, but we know it's hard because it's math and it's trying to figure out, you know, can I get affordable insurance through my work? But this sheet in particular, when we talk a little bit later about where you can go to get in-person assistance, you know, this is a sheet that you could bring to that in-person assister to have them help you. So what you want to look at is a couple things. The top bullet point, ask your job for this information. So obviously if you are your own boss, then, you know, do you offer insurance or not? If you have other employees, that comes into play. But if, you know, most likely a lot of you that work out of the home aren't going to have an employer who's going to be providing insurance. But what you might have is a spouse who could get insurance. And so if somebody in the household, whether it's you or a spouse, remember, you're thinking about who do you file taxes with. If somebody in the household has an offer of insurance, we need that first section filled out. We need the employer to let us know. You have to ask your job, is the employee eligible for coverage now or in the next 3 months? So we need to figure this out, is can that employee get insurance? Again, what's a little tricky here is that, you know, when we're looking at is insurance affordable and is there an offer of insurance, when it's looking at can you get it through your job, it's only looking at can the employee get it through their job. So this is where I really encourage you, if you're in a situation where you personally cannot get insurance because you don't have a larger employer, but your spouse can, your situation is going to get a little more complicated in a hurry. And this is where I'm going to encourage you to reach out to a local person who does these kind of applications or our organization directly, but I'll make sure you have that contact information, because what happens sometimes is that maybe your spouse can get it and then that's excluding you from getting it, and it gets complicated, but that's something that we want to work through with you. I think the takeaway of this is that we first need to explore if health insurance is available from a job. And the second bullet point on this kind of explains that if you can get affordable health insurance from your job, then you can't get that financial help when you sign up for the marketplace, and so that's why we really have to explore this option first. If you kind of look at the sheet a little bit more, you'll see that it comes down to the math problem here, is that it's, does that monthly premium, is it 9.66% of your household's income or not? And so that's where, again, there's math behind it, but we need to kind of first figure out, can somebody in the household get insurance from their job? Once we've gone through that and ruled that out, sometimes it's not ruling it out. Sometimes it's just helping you get signed up through the employer. But if that's not available, then the next thing we're going to look at on slide 18 is Medicare. So Medicare is if you are 65 or older, or have end-stage kidney disease, or receive Social Security disability insurance. There's this waiting period, though. Basically, if you qualify for Medicare, then we need you to get signed up for Medicare. And there is that 1-800 number, or you could go to medicare.gov to get signed up for Medicare. Let's say you're not eligible for Medicare, you're not eligible to get insurance through your employer, then what we're going to look at is Badgercare Plus. So Badgercare Plus is low-cost or free health coverage provided by the state of Wisconsin. This is Medicaid. So similarly to how the marketplace gets referred to by Marketplace, Obamacare, ACA, all that stuff, Badgercare Plus kind of has a lot of different names that get thrown around. Sometimes people just call it Badgercare. Sometimes they call it Medicaid. Sometimes they call it MA for medical assistance. Sometimes they refer to it by their card, which is the Forward Health card, and it says Forward Health on it. So it gets called a lot of different things. If you are in a group center, you might have a lot of your children that come to you that might say that they have state insurance. They're referencing probably Badgercare Plus. So it all kind of means the same thing. This program is for lower income adults, parents, and children. So there is kind of an income cap, and you have to be below that level to be eligible for Badgercare Plus. The thing with Badgercare Plus is you can sign up at any time throughout the year. So there's never an open enrollment period. If your income is in the time frame, then you're going to be able to get the Badgercare Plus. I'm sorry, I kind of saw a question come in, but I'll let Andrea kind of vet those as I keep talking about Badgercare Plus here. You can also go to access.wi.gov to sign up for not only Badgercare Plus, but at the same time, when you do that application on access.wi.gov, you can also sign up for Food Share, which is the food stamp program, and Wisconsin Shares, which is child care assistance at the same time. So somebody, if they say, you know what, nobody's working in the home, we have no income, well, then we know that their income is eligible for Badgercare Plus. And a great thing to do is to have them get connected to all those services at one time. Slide number 20 kind of explains the income chart for Badgercare Plus. And the thing about this is that we provide this information because people generally want to know, am I going to be able to get it? But quite honestly, at the end of the day, until you get into that application, until you're entering everything, we try not to guess. We try not to say in advance, oh, you're definitely going to be eligible for Badgercare Plus, or I don't think you are. The most important thing is to apply, because sometimes it's like, oh yeah, that counts as income, or something maybe you thought your assets were going to get counted, but they're not. You know, we don't really know what your income is going to look like until we really enter all those numbers. Basically, think of it like this: whatever you end up filing as your gross income when you file your taxes, that's kind of what your income is going to be when you're signing up for these programs. So that's kind of the number we're looking at. So when you're looking at Badgercare Plus, the first thing is you'd want to determine your household size. So once you look at your household size, only look at that number in the chart. So let's say there's 2 parents, 2 kids. You are a household of 4. Then what's the total household income? Remember, everybody you file taxes with. So let's say the total household income is $50,000. So we're a family of 4, and we make $50,000 between us, all of us. The men or women in that house would have to make less than $24,300 a year to get Badgercare Plus. That works out to 100% of the federal poverty level. So if the family's making $50,000, those parents are not going to be able to get Badgercare Plus. But if we keep looking across, pregnant women and children under age 19 are eligible all the way up until 300% of the federal poverty level. So in this household, if they make $50,000, the parents, that man and woman, they cannot get Badgercare Plus, but the kids can. And this is why we talk about that sometimes there's different insurances for different people in the family, because it's really going to be looking at what's your income. Okay, so I'm going to just answer a couple of the questions that I saw coming into the chat box. Specifically, I see one that says, do you need to have children to apply for Badgercare Plus? The answer is no. So as you'll see, there's 4 different categories we have here. So the criteria is that, you can't be elderly, so the 65 and older, or those other reasons why you'd have to get Medicare, but you can get Badgercare Plus if you are what's considered, even a childless adult. So a single man or a single woman, yes, as long as they fit under these income limits, though. So if it's just a household of 1, let's say there's 1 single woman, she's a household of 1, she can get Badgercare Plus just for herself if she makes $11,880 a year or less. So, nope. It used to be that you had to have kids, but it is not anymore. So that changed in 2014. So men, women, pregnant women, children, they're all eligible for Badgercare Plus. So hopefully that answered that question about if you have to have kids. So you do not have to have kids. Okay. Okay. So, and then the marketplace. The marketplace, as we already mentioned, is also known as Obamacare and the Affordable Care Act. Almost everyone can get a marketplace plan, but financial help is based on income. So here, let's look at that. Just like the Badgercare Plus has income for if you're eligible, the marketplace has income limits if you can get that financial help. So what the financial help is it means that you aren't going to pay as much for your monthly premium because you're getting financial help. So it's actually a tax credit is how you're getting that financial help. So if I fall into this range, let's think about our family of 4 again. 2 parents, 2 kids. If there's 4 people in the household and they make $50,000, that means that they are less than $97,000 a year. So they're less than $97,000. They will get that financial help for those parents. So remember, the kids were able to get Badgercare, but the parents weren't. Well, the parents are going to be able to get financial help. So what happens is when you get to the end of your application, it's going to tell you all these plans. So let's just randomly say, I'm just making these numbers up, but let's say that a plan said that it was going to be $500 a month. But that family can get financial help in the form of $400 a month. So even though the plan is costing $500, they're getting that tax credit or that financial help. It means the same thing of $400 a month, so that they, out of their pockets, are only paying $100. But again, to qualify for financial help, you have to be under this income level. So the marketplace in Wisconsin, we use the federal facilitated marketplace. So sometimes you'll hear federally facilitated marketplace or the national call center. Every state got to pick if they were going to use the national one or run their own marketplace. Wisconsin chose to do the national one. So to get support, you would call that 1-800 number or go to healthcare.gov. The call center is available 24 hours a day in over 150 languages. And here's the huge difference between the marketplace versus Badgercare Plus. the marketplace has an open enrollment period. To sign up for the marketplace insurance, and we're currently in one, you have to sign up between November 1 and January 31st. So people just have until the end of this month to sign up for coverage. There is some exceptions to that, and we'll get to that in a minute, but just so you know, that is the time frame. Okay, so I want to go and I'm going to read out loud a couple of the questions that showed up at the chat box. One of them said, I had an employee apply for insurance through healthcare.com, but she said it took her a couple hours, and when she returned to it the next day, the cost increased drastically. Is that common, or do you think there was a misunderstanding on what she needed was signing up for? Okay, so the first thing, oh my gosh, the red flag is like going off in my head, and maybe the person who typed this just typed healthcare.com, and they really meant healthcare.gov, but this is a huge red flag. Okay, if they really typed in healthcare.com, I don't want them to sign up through healthcare.com. That is not the legitimate site. The legitimate site is healthcare.gov. .gov, okay? So that is very important. There is a healthcare.com out there, but that is not the site for the Affordable Care Act. The correct site is healthcare.gov. So that's an important distinction. So first things first, we need to make sure that people are signing up either by the 1-800 number in the PowerPoint slide or at healthcare.gov. Let's just say that the person you're referencing actually did sign up at healthcare.gov, but maybe the question, you just typed healthcare.com. So no, that is not typical for somebody to go back the next day and to see the cost increase drastically. The only reason why that would have happened would be if they went back into the application and entered a new source of income. You know, maybe that they remembered, oh yeah, I have this part-time job, and then they added in that they make an extra $5,000 a year or something like that. But even then, I wouldn't expect such a drastic change. The other thing, though, that could be happening, and if somebody isn't real familiar with how this works, is that when you get to the end of your application, then there's like kind of two pieces. First, you enter all your information, and then you get to a point where you have to pick a plan. And the plans all cost different amounts, and so some plans, you know, might only have cost the person, you know, $100 a month, but other plans might cost $500, $600, $700 a month. So that's the only thing I can think of, is that if they were just scrolling through and for some reason they were, you know, looking at different plans than they had looked at the first time. But in this scenario, I don't know if the person actually picked a plan and signed up for it, but the very last slide that you're going to see in the PowerPoint has our contact information for our two offices in the state, and I would really encourage that employee to give us a call, and let's kind of figure out what was going on there. And then I'm going to look back up too. So it says, my husband is self-employed. I work at a small center as the 4K teacher. By small, I mean 5 employees. They do not offer health insurance. My husband has always carried the insurance, but it's too expensive. I signed up through the marketplace for all of the family, but still very expensive. Is there any kind of insurance that is a group for smaller centers, like a bunch of them coming together? Okay, so the first thing that I want to address is the cost of it. So looking back at slide 21 again, what may have happened is that that family size may be over the income limit for financial help. So perhaps you're not getting the financial discounts, which then, yes, the insurance is more expensive. The other thing that could happen is even if you are getting the financial help, you know, maybe if you wanted certain doctors or whatever it might be, maybe the plans that were available to you were still expensive. Also, an important thing to note is that different insurance companies provide plans in different parts of the state, and so the costs are very different when you go from one area to the next. And in some areas of the state, most have at least 3 different insurance companies available on the marketplace, But, you know, if you're in a county that only has 2, you just don't have as many options. And as you can imagine, when your area of the state doesn't have as many options, you also don't have as many options with choice, costs and things like that. So that's the first thing about the cost of it. And then the second piece of it is that, is there any kind of insurance that is a group for smaller centers, like a bunch of them coming together? No, not to my knowledge. And I don't want to say like a hard no, because, you know, every day I'm amazed at something that I didn't know about, right, with insurance. But what I would suggest for somebody like that, where they go to the marketplace and they just feel like, you know what I'm eligible for really still wasn't affordable, there are agents and brokers in every part of the state that help with finding insurance, whether it's through the marketplace or off the marketplace. And if you want to get in touch with me directly, I can try to help you find somebody in your part of the state. We have a whole listing of different brokers and agents. And usually if somebody isn't able to find an affordable plan on the marketplace, then I would encourage them to just talk to an agent or broker, because they know more. You know, they know about Medicaid, they know about marketplace, they know about things off the marketplace. And usually they're the ones who are going to be able to best shop around and find, you know, what's the best option for you and your family. They would also be the one that I would want you to ask that question of, is there any kind of insurance that a group for smaller centers could bunch together? Because they would be a little bit more familiar with something like that. The only time I've seen where somebody can kind of bunch together like that is if they have the same parent company. You know, so if you think about, we're all affiliated with this larger entity, but then we branch off into our own individual ones. But when you're kind of just all independent, I'm not aware of anything to help you guys all bunch together. Okay. So next one, and then the other question I just wanted to quickly address, that you probably saw the answer to, but if you're having any trouble with the handouts, that Andrea did say that she'll email them out, or feel free at any point to go to coveringwi.org, and then you'll be able to find the handouts there as well. So looking at slide number 22, as I mentioned, the marketplace does have that special enrollment period, but sometimes things happen, you know, life happens, right? And so there are these special events that if it happens, you have 60 days before or after that event to actually sign up through the marketplace. So if the first bullet point there, loss of coverage. So if you know, your spouse had a job and then they lost the job and they lost that coverage, well, then you all, you know, lost your coverage. You can sign up within 60 days of those special life events. Turning 26, so young adults can stay on their parents' insurance until they turn 26, but, you know, now they turn 26 and they lost coverage. Well, even if it's not open enrollment, they can go ahead and sign up through the marketplace. Or if you're no longer eligible for Badgercare Plus. So that might happen that, you know, your income was low enough that you were eligible for Badgercare Plus, and now you're having a great year, you're making more money, and, you know, by that, you're no longer income eligible, your income is higher, and so go ahead and sign up through the marketplace if you had a change. One thing that I didn't say before, but I do kind of tying into that whole idea, is that it's really important that when you're signing up for Badgercare Plus or the marketplace, that you do go ahead and report those changes as they're happening throughout the year. I know especially this happens a lot with people who are self-employed. You know, you're estimating how much you expect to make in the year. So if you were going to sit down and do an application on healthcare.gov today, it's going to ask you, how much do you expect to make in 2017? What do you expect your gross income to be? And that's going to be, what do you expect when you file your 2017 taxes? What's that number that it's going to come down to? But, you know, that's an estimate, and maybe you had a better year than you were expecting, or maybe you had a worse year. So as those changes happen throughout the year, it's always important to keep, whether it's the state through Badgercare Plus or the marketplace, to report those changes, because that does impact which program you're eligible for. Another thing with those special life events, just looking at moving. So if you had a permanent move outside of the county that results in access to new health plans, so remember there's different plans in different parts of the state, so that might cause you to have to change your coverage. Tribal members can enroll at any time throughout the year. So there is no open enrollment period if somebody is a member of a federally recognized tribe. Changes in the household, so if a baby was born, adopted, marriage, divorce, legal separation, death, things of that nature, when your household dynamic changes, that results in a special life event or special open enrollment period. Immigration, so if somebody got their citizenship or now they are lawfully present, then that would also cause a special enrollment period. Or if somebody just got released from jail. And this is part of our special enrollment period flyer that you would also find on coveringwi.org/learn. One of the things that kind of got mentioned in the previous slide, but we just want to point out for those of you who might be young adults yourselves or have children who are young adults, that they do have the option to remain on parents' plan until age 26 for the marketplace. If you're on Badgercare Plus, though, as soon as you turn 19, you're going to kind of become your own case. So they treat that differently. This is really looking at the marketplace for that. So this was kind of always the hot button topic when the Affordable Care Act first got rolled out, is people were saying, oh my gosh, you have to have insurance. What's this all about? And the law is simply that most people are required to have health insurance or pay a tax penalty depending on the number of months that you go uninsured. So when you file your taxes, there is now that question, and some of you might have noticed, whether you do your own taxes through TurboTax or go to a tax preparer, whatever it might be, where it's asking you if you had health insurance through the year. And if you check no, you are likely getting a fine. So here's just a quick look at what those numbers look like, and this is what people are going to be expecting. These numbers have risen. So the first year it was $95, then I believe it was $295, and now it's $695 per adult. So the way that they do the math is whichever is more, they're either going to look per person or percentage of your household income. And so it could be, $695 per adult or half of that for a child under 18. There is a maximum per household. Or you look at the percentage of income. When you do that way, the amounts get a bit higher. So just kind of, we like people to be prepared, especially people who kind of know this part of the rule but have still chosen not to have insurance. Sometimes we have people come in and they do the application with us, and then when they're done they say, nope, I can't afford that, I'm not signing up. And we say, okay, totally your choice, but we just want people to be aware that there is a cost. A lot of times they're going to get that tax penalty. There are some people who are exempt from the fee. And this would be, if their income was low, so maybe they could have been, it's basically if you're below the tax filing threshold, then you didn't have to file taxes and you're not going to get fined. There's also some personal circumstance situations, tribal membership, incarceration, etc. These are things that, again, you can talk to a tax preparer when it gets to that point and see, am I exempt in any way? Some of the exemptions are automatic. If they see that your income was low enough, you're not going to get the penalty. Others, you have to actually go and file paperwork to get that exemption. So we're not going to go into that today, but just kind of something to be aware of. I'm going to go through just briefly some options for immigrants. So children born in the U.S. may be able to get insurance even if their parents cannot. Adult immigrants who are lawfully present must have legal residency for 5 years for Badgercare Plus. So sometimes what happens is somebody's legally here, but they're an adult and they have that waiting period. So if you are, bullet point number 4, a legal immigrant and you don't qualify for Badgercare Plus, maybe because you're in that waiting period, or your income's a little higher, then you might get that financial help from the marketplace. If you do not qualify for marketplace coverage, so maybe for an undocumented immigrant who doesn't qualify or can't get insurance through Badgercare Plus or the marketplace, they aren't going to get that penalty even if they do file their taxes. So sometimes people file taxes even when they're undocumented and they wouldn't get that fee. And then the last bullet point, and this is really important, is that the information when people are signing up for insurance, that information is not shared with immigration or with law enforcement. Sometimes, people still aren't comfortable with sharing it, but the best thing we can do is to kind of provide information and handouts about the available options so that at least they know what they're aware of and their children are eligible for. Okay, so quickly I just kind of want to cover Badgercare Plus Prenatal. So Badgercare Plus Prenatal is for pregnant women with low income who have been denied Badgercare Plus maybe because they are undocumented immigrant or if they're in prison or jail. So their income is low enough for Badgercare Plus, but because of those reasons they aren't able to sign up for Badgercare Plus. They can get Badgercare Plus Prenatal while they're pregnant. So regardless, a woman with a lower income can get coverage while she is pregnant. They should apply as soon as the pregnancy is verified. So the idea here is you want them to have a healthy pregnancy. You want the mother to be healthy. You want the baby to be healthy. This program will pay for the prenatal care, labor, and delivery. And then women can get an additional 60 days of postpartum care if they immediately report the birth of the baby. So if they report it, and they can usually do that in the hospital, they can get that additional the additional care. So really, you know, as people that work in childcare environments, you're seeing pregnant women, you're seeing mothers. Please let people know that regardless of their immigration status, or you know, maybe you know that the parent is in jail or something like that, that really if the woman is pregnant and their income is lower, they should be able to get care. Then on slide 27, there is something called emergency services. So this is for people with lower incomes who have an emergency medical condition and cannot get Badgercare Plus, again, maybe because of immigration. Maybe they're an undocumented immigrant, but they had this medical emergency, so they got care. And it has to be a pretty substantial medical emergency though. So it's something that would put their health at serious risk if they don't get the care. So this is not ongoing health problems. This is not chronic problems. This is, you know, something happened, they broke their leg, they had to go in and get that fixed because, you know, you can't walk around like that. When that happens and they accumulate these large bills for the hospital stay or the care that they received, they could go back after that and apply for emergency services to have some of that covered. So this is important because what we don't want is we don't want people falling into medical debt. But again, this is for people who can't otherwise get Badgercare Plus or the Marketplace, and their income does have to be low enough though that to apply for emergency services. Okay. Slide 28, we like to put this in there because we know that at the end of the day, some people may not be getting signed up for insurance, but there are two resources that we'd want to direct people to. One is federally qualified health centers, which is also called Fqhcs, and this is something that are going to see people regardless of their ability to pay, and then also the free or low cost clinics. So those are something that we want to hook people up to in their community because we want people to be able to get the care even if they don't have insurance. Okay, so let's kind of pause for a moment and think again about somebody who says their family who's had Badgercare Plus for years, they've been happy with their insurance and their doctors, but now just got a letter in the mail saying they're no longer eligible for Badgercare Plus. They're not sure what to do. They're concerned because one of their children receives daily medication. What advice could you give? I will say this. Health insurance is constantly changing, and quite honestly, even for me, somebody who works in the healthcare field, it's a lot to stay up to date with. There's policies, there's little nuances, there's a lot to understand and to be able to then articulate that back to a family. We do not encourage you to try to have this all figured out. I mean, I'm sure most of you would tell me you don't have the time to retain all these little bits and pieces of information. But what you can do is you can know the resources that are available. So that's what on the next slide you're going to see on slide 30. This is kind of a way that you can help provide a family with, you can give them little bits of pieces. Maybe you're going to give them the health insurance options handout to kind of give them the basic info. But really at the end of the day, when somebody is having this issue or, some of the questions that came in the chat box of it was too expensive or the cost that I was seeing was increased drastically, what's going on here, we would encourage them to get in touch with an enrollment assister. So there are people who this is their job, this is what they do. And that's what we have at our offices as well. So what you can do is you can call 211. And if you're not familiar with 211, it's a statewide resource that they would provide resources to people, enrollment assisters who could help you with health insurance, but also just anything you can think about. So if somebody says, I have no food in the home, I need to find a food pantry, or maybe a teenager is going through some issues and wants to talk to somebody, for suicide prevention, whatever it might be, just think of it as the first place to call for help, I think, is kind of one of their taglines. So 211. So when you're thinking about health insurance, though, you could call for an enrollment assister. And so there's a lot of different terms that it might fall under, and a lot of it just has to deal with, how are they funded and what's their primary role. But it might be somebody called a navigator. That's what we have at our organization. It might be certified application counselors, which are called CACs. It might be a public benefit assister, a broker, an agent. The takeaway, though, is that signing up for insurance should be free. And so hopefully when you're calling 211 and you're saying, I need some health insurance help in my area, they should be able to give you contact information for somebody in your area who would not charge you to provide that in-person assistance. Another thing is that if you kind of know, okay, I'm uninsured and I want to sign up for insurance, we have something on our website, and so when you go to coveringwi.org, you'll see it from the homepage, but if you do the /enroll, it would get you there directly, is you can actually enter your zip code and then it'll tell you in-person application assisters in your area, and you can actually book an appointment right there with somebody in your area. And so it kind of depends on what part of the state you're in, but sometimes, you might need to go to the enrollment assister's office. Sometimes they meet at public libraries or workforce development centers, public health departments. There's a variety of different locations where they might meet. But basically what they would do is they would go through a health insurance application with you. So whether it's that you think you might be eligible for Badgercare Plus or the health insurance marketplace, they're going to sit down, do that application with you, explain it to you. And one of the big things is when, especially for the marketplace people, when you get to the end and you see all those different plans pop up, they aren't going to, be able to necessarily tell you, like, definitely pick this one, but they can explain all that stuff to you so that you kind of understand what you're picking. Okay. So the last case study that we'll read is just somebody, let's say Sasha, was paying $350 a month for a plan that did not cover all her health needs and was too expensive for her budget. When she reviewed her options with the navigator, she found that she could get Badgercare Plus or the Wisconsin Medicaid for her children at no cost, and that she could get a plan that covered more of her health care expenses, yet only cost $89 a month with financial help. So this kind of goes back to the person that said, they found that when they signed up and they tried to look at plans through the marketplace, it was still expensive. I would encourage just get in touch with an enrollment assister or that agent or broker in your area, because really sometimes there's little details that I don't want to jump too far into because it gets complicated. I don't want to go over people's heads too much. But one example is when you're on the marketplace, there's something. They go in different tiers. Metal tiers is what it's called. There's bronze, silver, gold, and platinum plans. Bronze, you pay the least a month, but it's going to be higher costs when you actually start using your care. Flip side, platinum costs a lot every month, but then it's kind of better coverage. You don't pay as much when you start going to the doctor. So when you get into that, there's these special silver plans, and so sometimes if you pay a little bit more instead of a bronze to get a silver plan, you're actually getting additional It's called cost sharing reduction. We like to call it a special silver plan, but that's something that when you're looking at it, you might not know and you might not realize, but a navigator would. And so that's where I really would encourage you to work with a local enrollment assister, because they're going to know those little things because they've been trained on it, and so they might be able to help find a plan that's more affordable for your budget. Okay. So I want to briefly cover some of the terms because we get questions on these all the time, and regardless of what insurance you have, you may come across some of these terms, and it's helpful to know, and so you can be better prepared for what the costs are. So the two main categories of costs that we think about when it's health insurance. Now, this is different because with Badgercare Plus, many people don't have these costs or they're minimal. But for all of you who maybe have employer-sponsored insurance or marketplace insurance, this is absolutely applied to you. So one is the premium. So I'm going to read it just word for word. A premium is the monthly payment you make to the insurance company for your health care policy. So again, going back to one of our first slides, the premium is the amount you pay every month, regardless if you're going to use it or not. You pay that monthly premium. A lot of times when people talk about how expensive their insurance is, they're talking about that premium. They see that number that they have to pay every month. But in addition to that, there's also out-of-pocket costs. These out-of-pocket costs are not included in your monthly premium. This is the amount you must pay during the year for your health care in addition to the monthly premium. And this might be deductibles, copays, co-insurance, amounts you're paying for prescriptions, all that kind of stuff. And so when we're talking to people about being able to afford their insurance, we want to make sure that, one, they can afford that monthly premium, but we also really want to look closely at what plan are they picking, because when you go to the doctor, are you going to be able to afford it? Are you going to have that money to front when you're going for your appointment? So on slide 34, you'll see that we dive a little deeper into these out-of-pocket costs. So deductible. The deductible is the amount you need to pay before the insurance company will start to pay its part. So as you kind of see that visual, you're paying for everything, then you hit your deductible, and then your insurance pays part and you pay part. What I want to point out is that for people that have a deductible, there are still some services you can get, and your insurance will pay part of them or most of them before you reach that deductible. So for example, everybody gets a free annual checkup, and if you're a woman, you get your free Well Woman checkup every year. So don't worry about not going until you've reached that deductible for your checkup. We want you to go in and get your checkups. But that doesn't mean that you might not have some of these other things that come into play, even after you've reached that deductible. So there's the deductible amount, and then there's something called a copay, and there's something called co-insurance, and people get these confused often. But looking at the copay, a copay is a fixed amount you pay for a service. So for example, let's say the doctor's visit when you go for something costs $100 and you have a $20 copay, so you're going to automatically pay that $20 when you go. Coinsurance is the percentage you pay. So let's look at that same $100 doctor visit. If you have, and it will tell you when you pick your plan, you have this amount copay and you have this amount coinsurance, and with the coinsurance a percentage. So if that same $100 visit you have 30% coinsurance, you'd pay that $30. So deductible, copay, coinsurance, there's all these different costs associated with it. And these terms that we've just kind of gone over, they're on a fact sheet at coveringwi.org/learn, and it's the one under the health insurance marketplace. It's called Getting Started. So these exact same images are available there. Before I go into the questions of understanding costs, I just want to, because I want to make sure I'm answering people's questions through the chat box. So one of the questions that came in is, Are you aware of an insurance company who works better with smaller businesses for offering insurance to their employees? No, not one over the other. But again, that is what I'd be happy to get you in touch with an agent or a broker, because it's very hard when you talk about, what makes insurance better, what makes one plan better than the other. Some people would say better means a low monthly premium, and some would say better means better coverage, that it covers more things. And so when you look at that, I just really want to make sure that an agent or a broker could really look at a little closer with you and talk about, okay, it's a small business, but what is it that matters the most to that small business? Is it the cost, or is it the benefits provided? But I'd be happy to get people in touch with agents or brokers in their area to go over all those options.
Jenny, will you go back just one slide?
Yes.
So I just want to say I think that is a great graphic at the top. Because that's always been a little challenging for me, frankly, and that makes it really clear. So that's all.
Great, great. And so please feel free, like I said, that one is under the marketplace ones, and this is something, especially because for the marketplace, you have to pick. You're picking what's your premium going to be, and then in addition to that, what's that deductible going to be? What's that copay and coinsurance? And so how I briefly mentioned those tiers, the bronze, silver, gold, and platinum, those bronze ones are going to have that lower premium, but they're going to have higher deductibles and copays and coinsurance. And so if you're only looking at the premium number, that's only one piece of it. And so that's where that in-person assister, and this sheet in particular, was created for the enrollment assisters to use during their appointments, and so that they can explain to people, okay, it's not just about that monthly premium, it's what are you going to pay when you start using your care. And I would say, too, about all these sheets, our hope was always to just help enrollment assisters, just help those of us talking about insurance to better explain our points through visuals and through simple everyday language. We aren't looking to all of a sudden say, okay, everybody on this call, get well versed on it and start handing out this info. I mean, if you want to, by all means, great. But it really is just to help reinforce the conversations those of us in service positions are already having, just to kind of help reinforce our points, and something that the consumers can take home with them, so that as they're home, they can kind of reference back to it to kind of grasp it. And maybe, you didn't go to the doctor yet this year, but now when you get a bill, you can kind of make a little more sense of it. So as we had said on slide 35, with understanding the cost, some of this was already kind of discussed, so I'll go over it quickly. But with health insurance, I get some services included in the price, free preventative services such as yearly checkups, but others I have to pay extra for. And that concept is kind of like a gym membership. If I use a personal trainer, I have to pay more. And so just that idea of, the monthly premium is just one piece of it. That's not everything. And then slide 36, good financial choices for your budget. So I know I've mentioned this already, but low premiums may have those higher out-of-pocket costs versus the higher premiums that have the lower out-of-pocket costs. And it's just, you're weighing your options and you're figuring out what can you afford and what do you want out of your coverage. So examples, when you kind of think about it in non-health insurance terms, is, if you have a car insurance plan with a lower monthly payment and a high deductible, well, then I will have to pay a lot more money if I'm in an accident, and that's kind of the risk you're taking. It's very similar with health insurance when you have something with a low premium, and that's where I don't really want to say like what is an insurance company who offers better coverage, because for some people it is better when it's cheaper. But for others, the second example, for the cell phone example, they'd rather pay for that more expensive plan with the extra data because they don't want to all of a sudden get these overage charges. So it's kind of how you look at it. Can you afford to, and do you want to pay more up front or not? So slide 37, what to consider. So we kind of went over the options, but for a lot of people, there's a lot of options, and cost is one piece of it, but the other things that we'd encourage you to think about is, number one, what are your family's health needs? Does somebody have a chronic condition? Does somebody go to the doctor regularly? We want to make sure that the doctor that you go to is covered in your plan, all those kinds of things. So what are your family's needs? Number two, do you have children that would impact maybe, what they're going to be eligible for versus what you're eligible for? Number three, will there be any babies born during the year? That's kind of a dead giveaway that you're going to be going to the doctor, you're going to have a hospital stay if you do, a hospital birth, that kind of thing. Number four, do you have a disease or illness and you need to see a doctor or a specialist regularly? Number five, do you have prescriptions? So that's, again, where an in-person enrollment assister is going to look at these things with you, because we want to make sure you're picking the best plan for your budget and your lifestyle. So slide 38, what is the set amount I'll pay every month, your monthly premium? Number two, how much will I pay to go see my doctor or a specialist? Number three, how much will I pay to use the ER? And that's just something that we just want people to kind of be aware of those things, because it may come up during the year. Number four, how much will I pay the deductible before the insurance company starts to pay its share? That was that visual that Andrea was referencing. Number five, this is I guess a number that I didn't reference yet, but that maximum amount I may pay for healthcare each year. So in addition to premium, deductible, copay, coinsurance, you're also going to see this out-of-pocket max. And that is, once you hit that amount, every other covered service that you have after that, you're no longer paying for, because you've already reached your max. So like for me, when I had my children, I reached that max, and so I knew, when I have those other things after that, after my child was born, I reached my max for the year, I shouldn't be getting any more bills, because I already paid my maximum I'm supposed to be paying every year. And then number six, how much will my prescriptions cost with this plan? And this can be a huge thing, especially if you have regular prescriptions. Let's make sure you're getting a plan where those prescriptions are affordable. And then slide 39, questions to ask about networks. So before you choose a health plan, you really want to look closely at what hospitals and clinics can you use that are in your network, and is your doctor or your specialist covered? Because different insurance companies have contracts with different health plans. And another note there at the bottom is that insurance companies have special deals with doctors and hospitals in their network, and sometimes that's great because then the savings are passed to you, but you really just want to be prepared and look at all these things before you're picking your plan. And that might be something too, when we talk about what's a good plan. For some too, it might be, maybe you're in an area that's a little more remote in the state. And in rural areas, maybe everybody's like, oh, I want to go to this hospital system. Well, then maybe you'd want to make sure that whatever plan you offer through your small business contracts with those clinics or those hospitals. So just taking a quick look, this is that Getting Started handout that I referenced. This is on the back of it, but this kind of puts all these costs together in one place for you to look at. So you kind of write your monthly premium at the top, and then you'd write in your deductible, and you'd write in your out-of-pocket max, and so you can kind of see going down, the arrow down, okay, the little pinkish area, I'm paying the full amount. And then I reach my deductible. What was my deductible that I signed up for? Then we're splitting the cost. Maybe that's the copay, the coinsurance. You're splitting the bills. And then you eventually reach your out-of-pocket maximum, and then after that, the insurance company pays the full amount of the bill for covered services. So this kind of shows people so that they have all these numbers and kind of keep them in mind. So go ahead and print this and use it, and write in your premium and write in your deductibles and out-of-pocket maximums to kind of keep straight all the costs that you would expect throughout the year. Another thing is that just on the side, the cost per visit, you can kind of look at the numbers in that way too, is that, okay, before I reach my deductible, remember, I'm paying the full amount, and so if I'm going to go see my specialist, I'm seeing my dermatologist, and I haven't reached my $750 deductible yet, well, I actually have to pay the full amount of that visit. The visit, that's just an example number, that $250. You would have to ask, your clinic, your provider, what the cost is going to be for that visit. But that's what I'd have to pay before my deductible. But after, Now that I'm splitting the cost with my insurance, maybe, you know, I'm paying the $50. So the math, again, this is where it gets a little harder because it's tough to figure out, but that is something that I'd encourage you to just be prepared for what the costs are going to be and talk to your healthcare providers, especially when you're in that phase of before your deductible, just so that you're prepared for the bills that you're going to get after you go to the doctor. Okay. So on slide 41, I just wanted to give the screenshot so that when you go to coveringwa.org, you know you're in the right place. This is our website, and so on there you'll see that, you know, if you go directly to the /learn, it's going to take you to this one, but it's the I'm looking for how-to sheets. So all those sheets that we referenced today are all posted on here. And then, you know, the first tab is the find local help. That would be if you wanted to enter your zip code and make an appointment, things like that. So feel free to browse around the website. If you ever can't find something, you can go ahead and get in touch with me, and I'll make sure that I can help you find what you're looking for. So on slide 42, I want to explain kind of what you're going to see when you go on the website. Our how-to sheets are categorized in a few they're kind of chunked in related topics. So the first category is that signing up for insurance, and so that's where you're going to see the options one and the special enrollment period and the affordability worksheet. Most of them that we covered today, those all have to do with signing up. Then we have some that relate to using insurance, and these are really applicable to anybody regardless of what insurance you have. And so you'll see what's free with my insurance. You have health insurance, what's free. This relates to anybody. And on the back, you're going to see a listing of all the services that are free. These were all kind of provisions under the Affordable Care Act that every health insurance plan, they call it minimal essential coverage. Every health insurance plan had to have minimal essential coverage, and these are the different things that have to be free. Sometimes your doctor may not bring them up to you, but if you bring them up to them, you know, certain screenings and testings and things like that, they'll let you know that, yep, that is covered. That's free. Well, there's also a handout on there that says, I'm sick, where do I go for care? And it talks not only about ER, but, you know, calling a 24-hour nurse hotline and things like that. So I encourage you to take a look at those. Then we have a whole series that are very specific for people who have signed up for Badgercare Plus insurance. So it kind of walks you through the process of, I've signed up, what's next? Then we have our series of the Health Insurance Marketplace handouts. And then our last series is about financial choices. So this example here is one of them from our financial series, and it's, what can I do? I can't pay my medical bill. So that happens, right, is that, you know, you had something come up and now you have a $5,000 bill, or you ran your credit report and you all of a sudden see that there's this $800 sitting on your credit report for something that was, you know, years ago for healthcare that you didn't even know about. Things like that happen all the time. I mean, the amount of people that come into the appointments to sign up for insurance and they have all their, you know, check stubs and address and social security number and everything ready to go, and then they also have all these bills that are unpaid. So some guidance on how you can go ahead and make a plan for making payments on your medical bill. But those are the different categories. Like I said at the very beginning, you're welcome to use them. Also, we've had a number of people, particularly those that maybe work at group centers. Maybe you have a family night and you just want to have some of these out at a table. Maybe you're having a health fair or a health event or something like that and you want to hand these out. Maybe you want to hand something out that you think is really important just with the registration packet. Whatever it might be, go ahead and use them. And then we are working on getting them all translated into Spanish. Many of them are available already, and so if you're on our website, you'll kind of see this green button that you click on for the Spanish version. And if something is missing, if there's a topic here that would be very helpful for you, please let us know, because Stephanie and I are still in the phase of still creating additional materials. And then this is just a cute little video that's not even 5 minutes long, but I'm not going to play it right now in the interest of time, but if you'd like to go to it at some point, and it basically it's from Consumer Reports, and it goes over real briefly some of the things that we talked about today. what's premium, deductible, out-of-pocket maximum. It just kind of helps in this cartoony way you wrap your head around some of these terms. And maybe you absorbed it all today and you're good to go, and maybe you're going to get that bill from your doctor and you're going to be a little confused and you want a little refresher. So here's a little video that can help you out with that. And then the last slide that I'll draw your attention to is for questions. So when you have questions, so actually go ahead and type your questions in the box if you have them, but also, as I mentioned, 211 for local help is a great resource, or you're more than welcome to contact our organization. So Covering Wisconsin, this is our Milwaukee number, this is our Madison number. You don't have to live in the Milwaukee area to call our Milwaukee number, or the Madison area to call the Madison number, but just those are our main offices. You'll also see that the little stars show you that we actually have partner offices throughout other parts of the state. So we subcontract with other agencies, and they have local offices there. The coloring represents the navigators, the different navigator entities. So Covering Wisconsin, we're the green. So we, through our organization, we provide direct enrollment assistance to 23 counties in the state, and that's kind of what the shading represents. But honestly, at the end of the day, you're more than welcome to call me, to call our office, to send me an email. Another thing that we've been doing is actually going out to different locations. We have some set up with different Head Starts in the state where we're going to give this kind of training, probably a briefer version of it, but to their staff. And so that's something that you know, as part of some of our grants to do additional trainings. That's kind of why we were able to do this one today. But we might be able to make it work. I can never make any promises, but if you think that's a need for your own agency, let us know. Even if it's, they're more than welcome to listen to this presentation at any point, or we can do webinars, things like that. But our goal is really to make sure people know about their options, to know what they're eligible for, and then to help them get signed up. So I think we have a few minutes left. I'm more than happy to stick on the line to answer questions. And other than that, Andrea, if you have any other housekeeping things, feel free to take it away.
Jenny, thank you. Thank you so much. It's a lot of information, and you make it really easy to understand. So